So today I'm going to do a chemical peel demonstration just so you guys can understand how I apply it, how the patient feels, what I'm actually trying to combat here. Chemical peel or chemical exfoliation is done because as we age, we just don't exfoliate. Our skin doesn't exfoliate on its own as fast as it used to when we were younger. So, and as we age, we start to see sun damage and age spots and certain things like broken capillaries or some rosacea, wrinkles, fine lines, larger pores. That all happens as we start to age. So chemical peels are a controlled burn, right? And they come in many different types. So you can have a very superficial, medium depth, and deep. So depending on what we're trying to combat, depending on if you've had one or not, if you're on a series, there's a lot of different reasons why we do them, will be the reason why I take one or the other chemical peel. For her, I actually, before we started this, I dermaplaned her. So dermaplaning is when I take all the dry skin and vellus hair off. So basically what I'm doing is I'm using a 10 blade here and I'm taking vellus hair and dry skin off, okay? So that's what I have done previously to take all that off. Now, her skin is prepped and ready for chemical peel. What I'm using is a little bit of TCA. She has a spot here in the corner of her nose by her eye, a dark spot, and so in order to pull pigment like that, I know that I have to get quite deep with my peel. So I am going to spot treat with some TCA. I'm going to have a handy fan here when she needs it, and I'm just going to dab that on there. And I'm just going to apply as I see fit. What I'm looking for when I'm using TCA is a frost. It's coagulation going on. And it is also telling me that she's gonna get a peel if you see the frost. That's gonna peel right off, kind of just flake up and peel. So while I have that sitting there, Cass, how you feeling? Are you feeling that?
Yes.
Okay, burning pretty bad?
Not too bad.
Okay. I'm also gonna work on this little spot here.
Now that was burning.
There you go. You have your fan. Got it?
Yep.
Okay. So I'm gonna treat that little spot there too. But that's all I'm gonna use right now for TCA. I'm also gonna use a Jesner. So this is kind of a type of layering, although I'm only really spot treating, but what I'm gonna do now is use a TCA. I'm gonna use it for fine lines and wrinkles, tone and texture, rejuvenation, anti-aging. So I'm going to brush the chemical peel on, and I'm gonna get a nice, what I call juicy layer. So nothing dripping, but enough chemical peel to do what we need it to do. And you can see it kind of glowing. I'm also gonna, like I said, layer. I'm gonna layer right over that TCA on her too, on both spots. I don't typically sit, but I have a different table I'm working at, so I'm brushing down on my strokes here. I'm gonna go across the chin, down the other cheek. How bad you burning, Cass?
I'm burning a little.
What's your number from a scale of 1 to 10? 10 being you want to jump off my table and get out of here.
7.
7. So you're quite hot.
Yep.
All over?
No.
Just in areas?
Yes.
Okay. Now, the reason that she's feeling more hot as well is because I dermaplaned her prior to this. And when you dermaplane and take that top layer of the skin and some vellus hair, that actually makes whatever procedure you're doing deeper. And she knows that, and we talked about that, and she's a client that I've worked on for quite some time now, and she totally trusts me. At least I think she does.
I do.
But, we know that dermaplaning makes everything deeper. So, Jesner's is a self-neutralizing peel, meaning that it's smart, it stops on its own, but TCA is something that I have to neutralize. And I'm getting, come here for 1 second, Sarah. If you actually can see her skin, this is called crystallization. There's some salicylic in this, and this is exactly the role of salicylic. You'll see crystallization. If I actually put a flashlight up to that, it's going to be glistening. So I tell people that they're blinging out. This is an actual frost, which is, again, it's hard to understand what I'm probably saying, because you're probably looking at that thing, crystallization and frost looks pretty similar. Frost is here. So frost is more of an area that turns white, where crystallization is just almost like a film or something over your skin. But what I'm going to do right now with the TCA, because I know it's hot and it's been on there for a few minutes, I'm actually going to neutralize that. And what I'm doing is telling that chemical to stop penetrating. Okay? So I'm neutralizing those 2 TCA spots. How you feeling? What's your number at? Climbing?
No.
Oh, it's going, getting lower?
Yep.
Okay, good. And so now what I'm going to do is, like I said, it's basically neutralized on its own, the Jesner's, but I can use a remover wipe and to just remove that salicylic, just so she doesn't go home with a film on her face. So chemical peel process is very quick. Chemical peels can be on your face anywhere from 1 to 10 minutes typically, and they can do a lot of damage. It's a controlled burn. But when we're trying to correct wrinkles, when we're trying to correct sun damage, when we're trying to correct pore size, things like that, a series is always necessary. There's never typically a one and done treatment. You guys will hear me say that quite frequently. One peel, a deep peel, one peel every 4 weeks for about 4 to 6 peels until we really get correction, and then it's maintenance after that. So how are you feeling now?
Very good.
Starting to feel better?
Mm-hmm.
Okay. And now what I'm going to do is I'll apply some cream to just relax her skin, take the erythema out of it. It's a recovery cream. I don't want any water on your skin. And the TCA is different. TCA, I don't want water on your skin for 6 hours. The other ones are 3 hours. I don't want any water. So no working out, sweating profusely, no washing your face. Just baby your skin for the rest of the day, okay? Try not to wear any makeup.
Okay.
All right, so I'm going to put some cream on you, and that is a chemical peel.